What I want to bring out is the exact thing that you said in YouTube, like you had a condition.
I had a
And-
condition that had they used the standard treatment like they said that they want the bureaucrats to decide for us, I wouldn't be here because the medicine for the standard treatment wouldn't have made me heal me.
Oh,
So then Medicare D didn't even want to pay for it. They said it cost too much money, and since I was older, they weren't going to do it. So as I sat there in tears trying to figure out what was going to happen to me, I was in Walgreens at the time. And so they said, Betty, go on the internet, which is easy for me to do, to go on the internet and see if you can find a clinical trial. And sure enough, the University of Chicago was having one, and that's how I got my medication. I was given of last year. By December 14th, I was in remission.
wonderful.
Yes.
Whoa, that is something. But now, give me that that YouTube I put on Church, Ohio.
But the YouTube you put on Church, Ohio, I said that I don't see any need to reform Medicare because they're not doing it anyway. They're making an extension of Medicare. I said, give us the same type of insurance that the Congress people have.
That's right.
And I said,
And then since I pay for it through my taxes, I should have the same thing that they have.
Hey, man.
because the current proposals exclude the president and congressional members. And I asked Betty, I said, well, should the president have the same plan that
Yeah.
we'll have? And what did you say?
I said, he should be the same as everybody else. I said, we put them in and we'll put them out.
Thank you.
That's what
Yeah.
got me.
Well, I think
That
that's
was-
well said, Betty and Mary Ellen. I'm Jim Komanecki. I'm the president of RestoreAmericanLiving.com. I'm also, along with the other panelists, I'm very concerned, gravely concerned, I would say, about the healthcare legislation and also the process under which it's been written. First of all, at RestoreAmericanLiving.com, we're about defending American values and conservative principles. And everything about the healthcare process is openly in violation of that. We're a free country. Our liberties are in danger, and this process is indicative of that. Specifically, we're very concerned specifically
I
about...
can't think it aloud.
Yes, I will. We're very concerned specifically about abortion as a healthcare right, as I'm sure you are, Ernestine.
Amen.
And also the fact that not just the beginning of life is in danger, but also the end of life, because this bill, contrary to what you may hear from the mainstream media, this bill does have what are called jokingly death panels, but there are provisions in the bill that will mandate the government activating your end-of-life plan, and they have the ability in the bill, and that's something every American citizen should be very, very gravely concerned about. Another of our concerns of health care benefits for illegal aliens. And I will say this, like all Americans, who is injured in a car accident or any other type of mishap, certainly we're going to come to the aid of that person. But what we're really talking about here is whether or not illegal aliens will have the right to regular and customary care and preventative care. Those things are things that American citizens pay for, and those benefits should be reserved for American citizens. Big concern with the health care bill is the fact that the Democrats have refused and have consistently voted down amendments that would have put tough and strict citizenship verification provisions in the bill to ensure that under the proposed legislation, only American citizens would not only be eligible for benefits, but would in fact receive them.
Now, specifically, the plan language, and I printed it out here, this was the HB 3200. As of today, I believe the bill has grown to another 500 pages, so the latest is 1,500 pages. So when I printed this out and I paged through it, looked through it, I saw the language. Yes, there's no wording like abortion, but now the term that includes abortion is women's rights, women's health care rights, reproductive rights, just like for illegal aliens. The language is very vague. For instance, it'll say something to the effect of a person who's at a certain address, eligible for health insurance, the entire family is then covered. It suddenly broadens it. Well, that could be anybody. So the way it's done is very vague. It's taken it out from congressional oversight and put it under secretaries, under the president, a group of them. It's all kinds of different studies, and based on studies, thus and thus will happen. You and I, if we get a health insurance plan today, it'll state your deductible, it'll state what you're eligible for instance, in Medicare. The booklet.
Is that the public option part of it, or is that?
Well, I'm just talking in general terms of a general health insurance plan, even a Medicare plan. It will state what the plan will cover specifically, like 80% Medicare covers after you meet your deductible, and then 20% you're eligible or you're on the hook to pay if you don't have a supplement, okay? This has none of that type of language. Now, you mentioned a public option. Everything here is, you don't have to include the words public option, because what they're saying is, and this changes daily, is that you are required to, if you're, for instance, if you're an employee, the employers will be required to cover you, okay? Well, if that's too expensive for the employer, they give the employee or the employer an option for you. He gets a penalty, which may be 8% of his payroll, but currently he may be paying 20% of his payroll in health insurance premiums. So for the employer, it's better for him to pay the penalty to the government. And then you're out on your own, and the language is such that if you have been covered under an employer, you cannot go to another private. You can't go to a private plan. You would then have to go to the government plan. So, and there's variations in the different bills out there as to how all this would work.
Well, I think you're right to criticize the extent to which the plan is
I
overly
can't need to hear. I
Oh,
want
yes.
you to.
Let me speak up a little bit. Maybe
yeah,
it's the
please,
microphone.
because I'm
Yeah, I was complimenting Mary Ellen on the fact that she's rightly so in critiquing the bill from the standpoint of the fact that it's burdensome, it's cryptographic, it's difficult to decipher. It certainly has every potential to take away our liberties and to deprive us of our health care freedom, and putting the entire private insurance industry out of work. Everyone who works in private insurance will be out of a job, and all of those people will be added to the rolls and the ranks of the unemployed. In America today, we have almost a 10% unemployment rate. We are literally in the second Great Depression, and if you count those who are underemployed or have given up looking for work, the real unemployment rate is about 17%. And I really seriously question this administration with respect to its lack of wisdom in putting additional people out of work from the insurance industry at a time when we have so many other people who are desperately seeking a job and can't find one.
And about, you were showing this graphic that you had.
Yes.
It made so much sense, and I go over that.
Absolutely. The graphic I'm talking about is the House Republican leader, John Boehner. And
What's his name? I can't hear
John
you.
Boehner, House Republican leader John Boehner. And basically the diagram, I don't have it with me, but the diagram is a very complex, confusing array of government institutes, government agencies, bureaucratic groups of people who